Welcome to the Chilmark channel. I'm Jody Rank. I'm a senior analyst with Chilmark Research. And today I'm going to talk about our upcoming report on trust in AI in healthcare. But before we begin, make sure you follow our channel, give us a like, leave a comment, and don't forget the notification bell. Trust has become an important form of social capital in the technology marketplace, particularly in healthcare. As we've seen with COVID and immunizations, lack of trust in new technology can significantly hinder their success. So at Chilmark, we've decided to do a deep dive into the basis of trust for AI. In the last several years, we've seen a number of problematic models enter into the marketplace, some that had racial bias or some that recommended the wrong medications and so forth. All of this can damage the reputation or trust in a new technology such as AI. So in our report, we were going to cover a number of things that developers of AI tools and services can address, from things like implicit bias or racial bias in algorithms to how do you explain how this model works to both a payer or a provider or a patient. These are things that the individual organizations can do. But the biggest part of our report is looking at what the industry itself needs to do. This goes beyond any single company. And we talk about things such as this intangible economy, investing in institutions and practices that can help enable better products and services to reach the market. So the reason why we're focusing on the intra-industry collaborations and this intangible economy is we see the FDA lacks the budget and to address many of the emerging ethical and patient safety issues that matter most. So in our report, we cover a number of things that the industry will need to do together to ensure better AI products reach the market without the risk of harming patients. And how do we create better transparency so that people understand where the data come from that underlie this model, what certifications we have for explainability, bias mitigation, and other forms of risk, as well as the impact on overall health equity. Health equity has become a major goal of the system in recent years, and AI has the ability to undermine that if done improperly. So we hope this report can help stimulate a much wider debate about AI in the marketplace and things that we need to do together to address some of the risks of AI in our present healthcare space. So one example of an area that we cover in the report around bias, for example, is the issue of dimensionality of data. Digital health data is very complex. And we're often seeing that once an AI model is introduced into the market, its performance begins to decrease, and it actually can do harm. This is due to what's called the curse of dimensionality. So when you're training a model on a training data set, there can be blind spots in that data. And then when you you begin to introduce that model into the market to a bigger population, that blind spot can increase exponentially. So we look at how developers of AI algorithms can address this curse of dimensionality and hopefully improve performance over time. This is a major challenge in the current state of AI in healthcare. To stay up to date to the status of the report, subscribe to our newsletter, and the link is in the description down below. If you're new or lurking, welcome to the Chilmark family. If you have any comments or questions, leave them below and we will help you out. Thank you for watching.